Hello, and welcome to our Introduction to Health Literacy, Part 1 of the Bell Eque Library's Health Literacy Workshop. Let's begin by taking a moment to think about what health literacy means to you. Most likely, something about a patient or client's ability to understand and use health information is what came to mind. Probably something similar to the definition published by the Institute of Medicine in their 2004 report, Health Literacy, A Prescription to End Confusion. And a patient's abilities are certainly a big part of health literacy. However, as a clinician, I'd like you to consider another possible aspect of health literacy, your role in your patient's or client's health literacy. A little while back, Rima Rudd, a health literacy researcher at the Chan School of Public Health at Harvard, proposed expanding how we define health literacy to include the responsibilities of clinicians and healthcare systems in the concept. And it is this expanded concept that is the basis for this workshop. As you move through the series of videos, please keep this question in mind. How do I, as a clinician, influence the health literacy of my patients and clients? To begin, though, let's take a step back. As the title of this segment says, this is an introduction after all. Let's begin with the state of health literacy in this country. Only 12% of American adults rated a proficient health literacy level. This is according to the 2003 National Assessment of Adult Literacy, which was the last time health literacy was measured on a national level. Although shocking at first, when you think about it, it probably isn't terribly surprising. Think back to conversations you've had with friends and family who don't have the education you've been receiving. It must feel like you're speaking different languages sometimes. And here's some real data to back that up. According to the Literacy Project, 50% of American adults read at a 7th grade level or below. The U.S. government recommends that patient education materials should be written at the 5th grade level. But in actual fact, according to several studies, most consumer health information is written above the 7th grade level. I've cited just a few of the many studies here. So why is this important? What's the big deal? So patients and clients won't understand everything you say. They'll get the gist and it'll be fine, right? Well, there are real consequences to low health literacy. It leads to less use of preventive services, lower rates of adherence to treatment, lower rates of referral and follow-up, higher rates of hospitalization and emergency department use, higher healthcare costs, and lower health outcomes overall. Very real consequences. So how does low health literacy happen? Let's look at the patient perspective first. There are many factors that influence health literacy. Some are obvious, things like educational attainment and general literacy. Some come from societal factors like socioeconomic status, political influences on access to education, systemic racism. And finally, the factors that tend to be less obvious and certainly not something you'd read in a patient's records, situational factors, media exposure, stress, possibly what a person had for breakfast or the argument they had with their partner that morning. All of these factors can influence a person's ability to process information. But way back at the beginning of this video, I was encouraging you to think about your own role. Let's turn to the clinician's perspective. What are some of the ways you influence the health literacy level of your patients and clients? Well, it's things like interpersonal communication, the words you use, the explanations you provide. It's also the complexity of our healthcare system, specialists, referrals, insurance. Finally, the implicit or unconscious biases we all have that can subtly or not so subtly influence how we interact with another person. All of these factors can take practice to even notice whether you're doing them or not, and certainly take planning in order to avoid. The next 3 videos in this series will dive deeper into the issues this introduction raises, and also provide tools you can use to help you prepare to work with the variety of health literacy levels you will encounter. I'll leave you here on the list of references we use to gather this information, but if you have any questions, please don't hesitate to get in touch with your Bell Eque librarians.